Avast and hold fast, me hearty lads. The Leviathan in his great tumult brings the depths to a rolling boil, and the Kraken spreads wide its clawed and many-suckered tendrils, ready to take us down as if in a lover's embrace into the inky brine, while the locker sifts about its wretched denizens beyond count, making vacancy in that woeful brig just for us. And a sudden plunge and a sullen swell, 10 fathoms deep on the road to hell. But before that, stimulating conversation amongst our shipmate masters of the Razor. That's all well and good, yeah? But, what the fuck? What are we? Whalers, pirates, privateers? I've got no direction here and fail to understand the first thing of what barbering has to do with nautical themes. Are you serious right now? Are you complaining about that theme in character? Fucking shut up. Shut the fuck up. Jesus Christ. Pomps and Plunder, everybody. Shit.
Avast ye Scallywags. You're listening to the Pomps and Plunder Podcast. Do it. Laugh.
How are you breaking character already?
What's my character?
It's 5 seconds in, and we're derailed.
Yeah. Well, in the first episode, we say this is going to get derailed all the time. But
I think it was a Scallywags. That's where it went downhill for me.
Avast ye Scallywags.
I've never heard anyone say it. Maybe like Pirates of the Caribbean.
You're listening to it is called Pomps and Plunder Podcast. But on today's episode, we're talking chiropractics with Skylyr Strader. Did I say that right?
Yeah, but it's a mononym, just Strader.
And Bri Wolfer, who is dying right now.
Slowly but surely.
Thanks for coming. This is
Pleasure to be here.
Yeah, the conversation's been pretty wild pre-podcast recording, so this is going to be a fun edit. So basically, we just want to jump into. I don't think a lot of people know a lot about chiropractics. I don't know how to word that question.
What is it?
Well, yeah. Okay, what is a simple term of chiropractics?
You want to take it away, Wolfer? You can start us off since you're self-conscious about not talking enough.
I have no affiliation with chiropractic. No, I'm just kidding. I mean, that's really hard. What is like a good definition? I mean, you could probably go really philosophical if you wanted to, but maybe you should take this one.
Yeah, so we're doctors who crack backs. And occasionally necks. And other joints if you need it.
Doctors who crack backs. I fucking love that.
I mean, if you want my professional definition that I give it like Chamber of Commerce meetings and shit, we are a realm of healthcare that provides non-pharmacological, non-surgical interventions for acute and chronic neuromusculoskeletal conditions. Essentially, we fit on the pyramid of hierarchy right there with physical therapy. Essentially, an ideal chiropractor, an ideal physical therapist probably looks relatively the same. We serve the same rung in society.
Dude,
that sound okay?
That was great.
Good, yeah.
That was good. Podcast
well, I've had
over.
to give this fucking talk at a Chamber of Commerce before, so.
I mean, okay, so starting, what got both of you? How long have you guys been practicing chiropractic?
I'm an old ass, so I've been doing this is in my 7th year now, which actually sounds wild to say, but I guess the gray hairs give away how long I've been in the profession. I graduated end of 2018. My start with chiropractic was I was 3 years old when I got my first adjustment for my dad's best friend. That apparently the adjustment was because I was fucking miserable from chicken pox. And so my mom told me that my dad's best friend came over, the local chiropractor. I was miserable on the carpet in the living room, and he adjusted me, and I got up, and all the spots were gone. Psych! They were all still there, but I just didn't have, I guess, the discomfort or something, because my mom says I started running around and playing then, and if she hadn't seen it, she wouldn't have believed it herself. Do I advocate taking your child with fucking chicken pox to the chiro? No, not really. But that's my origin story, apparently. And I don't have memories of when I was 3, so I have to listen to others.
That's... What about you? See, so I've been recording this whole time, and you were just popping off.
Yes.
And now it's like, hey, okay, we're getting...
Oh, I'm so shy. I'm a fucking turtle now.
I'm not shy. I want to be... I don't know. I don't want to mess up the sound. Exactly.
That's for the sound editor to...
Yeah. This is all edited.
Well, then it's like a lot more work, and then I feel bad. But anyways, back to me. I'm going into my 4th year. I graduated at the end of 2021. I got into chiropractic through undergrad. The first time I saw a chiropractor, I was powerlifting in high school, and I hurt my low back deadlifting. And a chiropractor treated me, thought it was awesome, forgot about it, went to school to be a veterinarian, worked at a vet's office, hated it, started to get a lot of stress headaches, and then I went back to the chiropractor, see if I could relieve some tension in my neck. And then I was kind of like, oh, I could do this. You know, everyone's decently happy to be there. The chiropractor was decently happy to be there. Not like a vet's office where dogs, cats hate being there. People don't really like being there. So that's kind of how I got into it. I've never had chicken pox. Just want to put it out there.
Oh, get ready for the fucking shingles when you turn 48.
Well, no, if she hasn't had chicken pox, she won't have shingles.
You can still get shingles.
I'll be fine.
But I've heard from my mother that if you haven't had chicken pox as a kid, if you get as an adult, it is like 100 times worse.
Yeah.
That's the have fun part.
I'll be fine.
But I mean, there's a vaccine for it now.
Yes.
Isn't there? So have you had that?
I got that when I was a kid, I believe. Yeah.
Okay. I unfortunately was too old.
Yep. I'll do it.
Yeah, 90. I was a 90 kid, and then it didn't exist.
Old ass.
So one of the things on the podcast we like to talk about is the nitty gritty and the horror stories. I'll let you start this one because you were saying you have a lot.
Oh yeah.
So what's some of your chiropractic horror stories?
Ooh, do you want like a category or just like get into
what comes to mind?
Okay, so
all of our episodes are improv. Like we're like, here's a topic, we're just going down it.
Okay, sick. Okay, cool. So this was actually like a few months ago. I had a patient with a giant cyst on their back. And the way that I practice, I do some soft tissue work. So you can kind of think of like a brief little deep tissue massage. That's what soft tissue work is. There's also other techniques, but that's what I was doing. So I was trying my best to avoid it. And then at one point I did move over the cyst. It exploded everywhere. Everywhere. And it was the worst smell I've ever smelled from a human being. And like, mind you, we're pushing on people. There's a lot of smells that come out of people, but this one smelled like probably skin garbage. And I'm a pretty strong stomach. I do like watching like pimple popping videos, so I like those as well. I was okay with it. I was fine. But I think it was just the comment from the man, and he was very, very excited about it, and he's like, wow, I can make that smell. I was like, oh no, sir. So yeah, clean it up. I let him know like, hey, go to your dermatologist because that's not me. And then afterwards, clean the table, clean everything. He left. My boss came in and she's like, what is that smell? She's like, did someone like go to the restroom in their pants? Like, what happened? And I was like, no, it was someone's cyst from their back. And she immediately starts gagging to the point where she's gonna throw up. So that was probably top tier. That was pretty gross, but also mildly entertaining and cool. Thankfully, I was wearing gloves at the time.
Was
so.
was the skin around it all like saggy?
Yeah.
Yeah.
Yeah, that stuff. It was probably the size of like a marble. No, that's too small. Maybe like a golf ball. That thing was pretty big. Pretty big.
That's wild.
'Cause, yeah, golf balls like that. Yeah.
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 That's crazy.
Yeah, I got a lot more, but Strader, why don't you take it? Take it from here.
Sure.
Yeah, we can go back and forth on that.
Let's see. I'll give a different take on a horror story. So one of the big things you're always concerned about if you are what we call in the profession a portal of entry provider, meaning that you take people who just walk in off the street with whatever bullshit they have. They're not getting screened by anyone to where they're going already to where they should be. So my case was a little bit different. I met the guy on the second visit. So I didn't do his initial exam. I just looked in the system, looked like a pretty generic hip pain, shoulder pain guy. I think it was, let's say, right hip, left shoulder. He's like 60, he just turned 65, just got Medicare. And when I'm talking with him, he's like, yeah, haven't been to the doctor in fucking 38 years, whatever bullshit. And not usually any problems. So I treat him, adjusts relatively normal. All right, see you in a few days. Comes back in a few days. Hip pain's worse. He attributes it to a long drive in his truck. All right, I mean, that seems to track. Treat him. Comes in, visit 4. Worse and limping now. I don't really care for that. But again, he's like, I had to go to the same job site again. It's like 2 hours one way. Okay, fine. Treat him. Visit 5, he comes in. Now he's using a cane. General rule of thumb, you don't want your patients deteriorating as you're actively treating them and they're actually showing up when they're supposed to. So I tell him, I'm like, look, you're 65, you've got Medicare now. Establish with a primary care. If you know somebody, your wife, whoever, just establish with someone. Medicare, if your primary care sends you for imaging, especially x-rays, they will just pay it, so you don't have to pay anything out of pocket. He's like, okay. See him on visit 6, still worse. And I was like, okay, I don't want to see your ass again until you get established with the primary, because I don't like this. I think you might have avascular necrosis, essentially lack of blood flow to the head of the femur, and it will die. That's something that just keeps dying if you don't do anything about it. And there's no, I pop your hip and suddenly you get blood flow again. That's not how that shit works. So I take a Monday off. Another doctor is covering me. This is like maybe a week and a half, 2 weeks after. Patient comes in to cancel his plan he's on and to leave me a note that says the x-ray showed that he had metastatic cancer in the femur head, had spread from his prostate. He had to go see oncology, things like that. Didn't hear from him after that. I gave him a call. He updated me. Then I didn't hear from him. I moved jobs relatively soon after that. Didn't know. Told a front desk person at the new job about the situation. Somehow she figures out who that patient is. I don't even know how the fuck she did it. And looks him up. He died 2 months after I told him what was going on. So it could easily have been a situation where I just kept treating, attributing it to random flare-up stuff because of positional, let's say, considerations when he's driving. But thankfully, we were able to catch it. He at least had 2 months to get affairs in order, say goodbye to people, that kind of thing. Also, doesn't look good if you're the treating provider who doesn't find cancer and then they just fucking die. That's usually when you get malpractice and stuff against you. So that's one that's less of a ooh, big cyst pop type thing and more of a horror because you're like, oh, that's not good for my license and shit.
Yeah.
And you just got to be aware. You got to do your due diligence.
Okay, we'll go to the more light. Which, I mean, some of these questions I had, you guys could kind of already answered.
We have?
Yeah, some of them.
Oh, okay.
Can you pop cysts and zits when cracking backs.
It's not our scope. But
All right,
yeah.
so we'll go into a weird, quirky one here.
Hell yeah.
If you could adjust anyone in history, who would it be and why?
Well, I had a professor who said if he had his hands on Adolf Hitler, it wouldn't have gone down like that. But that's not my answer. Let's see. Anybody ever? Probably somebody like Andre the Giant, just to see, like,
If you could do it.
can I do that shit? Because, I mean, the biggest patient I've taken care of, I think, is 6'8", and the heaviest I've taken care of is 490. And I got that shit moving on them. So I'm like, could I do Andre the Giant? I don't fucking know, but that would probably be mine. Honestly.
That's a good one. What about you?
I like that. I'm so basic though.
Don't copy.
Mine's like a celebrity. I don't know.
Who?
I think it'd be really cool. I think it'd also be really cool to go to like one of those touring like festivals, like Warped Tour, for example, and just adjust anybody like in a band.
So have like a band chiropractic
Yeah.
thing.
Yeah.
When we were in incarceration, there was kind of an area that we had access to, the artist lounge, where we had like free coffees. There were barbers there, so I could see that being a thing at those festivals. That's really cool.
I know, like Shawn
You still didn't give a
Mendes.
specific person.
Oh, okay.
Yeah.
So anyone
Jesus.
from the band Bowling for Soup, aka my shirt, anyone from like 303, well, the two people from 303, but yeah, simple plan. Honestly, just any one of my favorite band people, that'd be really cool. Honestly, or most celebrities. Yeah,
Oh,
we
you
could go
know.
at it.
Probably be pretty sweet to adjust Jesus of Nazareth. Think of what would happen to my fucking hands if I touched that boy. Do I get like, I don't know, communicative type stuff? Osmosis steal some of that healing mojo?
I love that for you. I like that you reference like some guy that'd be huge, because like I feel like I keep track of like my biggest and tallest patients too, because after that you kind of have to like see what you can do after that.
Yeah. No, I've got my second biggest as an active patient right now, 460.
So one of the questions that Angel was going to ask was like, he's like, yeah, I want to be on there and ask, how do you adjust a fat boy like me or something like that. So what do
Honestly,
you guys do for bigger people?
Most of it is just leverage and technique is what it comes down to. Because like I weigh 183, but I can adjust the 460 pound guy. For the most part, no problem. One, if you've got a long enough wingspan to do a face up middle back adjustment, that shit's easy as hell. You just use their damn weight. I don't even have to do anything. You could probably just put like this fucking wallet underneath them and just lay them back on it and hit them, and it would probably work the same, honestly. They got enough just mass at default, because any adjustment is just force. It's mass times acceleration. If the big boy got more mass, then I got to do less.
So when you adjusted me that one time, it was, which I need to see you again, but it was, the things you did to me was wild.
Only behind closed doors what I did to you. For reference, there's an informed consent process. Everything is above par.
Everything was above. That's above what?
Aaron's gonna go through his trauma adjusting from you.
No, it was great. It was
It's why did I have to take everything off?
I'm like, bro,
Yeah.
I kind of was. I was like, because I was like early morning, and I just
early.
threw on some booty shorts and a tank top, and you're like, take your shirt off. I'm like, okay.
Take the shorts off while you're at it. Hey, some chiros gown every patient still. I don't know
it's
why.
a technique, whatever they want to do.
It's a technique. Put on the damn robe. Yeah, it's a technique, all right.
So, I guess just general questions of chiropractics. How often should someone see a chiropractor, or is it something that everyone should do periodically?
Let's let Wolfer take it first.
Oh yeah. I think it just really depends on the person, what kind of pain level you're in, and then also we do have a lot of people, like for me, I'm not necessarily in pain, but I'm stiff a lot, so sometimes getting a nice adjustment, getting some mobility into that joint feels good. But if you have someone who fell down the stairs, didn't fracture anything, but has some back pain from that, you're probably going to see him a lot more frequently than someone like me who just has like tension here and there. Yeah. I do think not everything is for everyone. Not every technique is for everybody. And then you do have, we've had a lot of patients, at least I have, who like just don't even like being touched. So for them, like it's even more just stressful, like for them to get touched and adjusted and all those things that I don't necessarily think it could be beneficial for them. What do you think, Strader?
Mine's just piggybacking off the same line of thought. Is it's different for everybody. Like she was saying, if you have like an acute trauma, if you come in and you're dragging your leg, can't lift your foot up, numbness, tingling, and like terrible pain, I'm probably not going to be like, yo, see you next month. You're probably going to need something more than that. I'm probably starting you 3 times a week is a pretty normal starting point. If you're in really bad shape, most of the patients I see in the setting that I'm currently working at, it's probably a twice a week starting off just to get you the relief quicker. But if I recommend twice a week and they're like, I can only do once a week, I don't tell them to fucking kick rocks. We'll just work with what they can do because they'll be better off for it anyways. It's really the bigger question in chiropractic. Everybody agrees on the acute care phase.
Yeah.
Across the board. Everyone's like, we know what
Always.
to do. It's really once you get to a point where you're like, I'm feeling pretty good. What do I do now? Well, it's different for everybody. I've got one guy, he just likes coming in once a week. It keeps him to where he never feels anything ever. Fine. I got some people that they like to come in once a month. We at least have research that supports if you have recurrent lower back pain, once a month is shown to be beneficial at reducing future episode numbers. We at least have that as of 2018. But beyond that, could you extrapolate and say, well, what if you came once a week? Would it have reduced those number of episodes even more? Maybe. It just hasn't been studied yet. But you have some people where I knew a guy when I worked in Tampa that he was of the mindset, if you didn't get treated at least once a week, you're going to get cancer and you're going to die.
Oh my God.
That's not what I subscribe to. But there's different schools of thought, some
Yes.
problematic, some realistic. And you're going to get different answers everywhere.
Yo, the way
Yeah.
you guys crack babies' backs is wild.
Ooh, we don't crack babies' backs.
I've seen that once, and I was like, mouth dropped.
I would say, so this is Wolfer's domain.
I'm going to take it over from here. So babies, you don't crack their back.
Or adjust, the whatever.
Yeah, so
I'm
you-
not a chiropractor.
you can adjust. You can adjust a baby using your hands with light pressure. It's almost like if you were like checking the firmness of a tomato at the store. Like you're not gonna squeeze on that tomato, let it burst. Like you're just gonna
I might.
kind of touch it a little bit. Or you can use an activator, which is a tool, an instrument for adjusting. People call it the clicker. Use that for lower level
The
adjusting.
person I saw do this was like dangling
Yeah, that was.
from like holding one leg. I'm like, what is this?
That one we don't condone too much, but you know, there's weird apples.
So it's kind of gotten like more and more like, oh, we don't do that anymore.
Yeah, I think that was just also, you never know what people are doing on social media and like who they actually are and what license they have to.
This wasn't social media.
Oh shoot. Okay.
I saw this in person.
Oh no. Okay. You know, I guess.
Oh, Lord. From a school around here.
Oh. Okay. I don't know. Do you know what he's talking about?
I mean, I've seen when I was in class them demonstrating on like a model some kind of leg check thing or another. When I saw it, I was like, I ain't doing that shit. But I already...
Where they dangle it?
They were dangling by both legs, and it was like, if the baby turns to the left, they've got a whatever, blah, blah, blah.
Oh, really?
Disclaimer, I am not specially trained in pediatrics or pregnant patient. However, I'm a realist. Number one, I wouldn't personally do it because I think it looks fucking weird.
Yeah.
And as a general rule of thumb, if you're doing things that look fucking weird, it's easy to get them misconstrued, or it's easy for people to just disregard what you're doing entirely. For me, is there a place for infant adjusting? I'm going to say infant meaning they're like not walking yet. Once you get to about probably like 3 or 4, you kind of start adjusting more normal compared to like an adult. Just you need way less depth, way less force, because their spines are already pretty mobile. Doesn't take as much, and you'll get actual true out of them.
That was nice. That sounds
thank
so
you.
good. Yours sound painful.
Honestly, they probably are.
But when you're working with babies, it is a much more subtle thing. A lot of times they cry because like you're putting them in positions that maybe is a little uncomfortable, which is just they don't want to turn their head to the left because they've got little torticollis or whatever it may be, and so to fix it you gotta like turn their head a little bit to the left when you're working on them. So
what was that face again?
it's a head jutting forward.
We've been debating on doing video for this.
I'm so glad we're not.
I'm down for video. What do I got to hide?
I just like didn't prepare for that. Now I gotta worry about my face.
Oh my
now.
god. But Aaron didn't even hook me up with a shave before. I look like a fucking
Sorry.
raggedy asshole.
He's looking like Waluigi right now. He's trying to be Mario in a Wordle.
I actually like the scruff.
Yeah?
Yeah, like when I see the stash looks, I think the scruff looks good.
For me, the scruff's okay until my psoriasis flares in it. And then it's, number 1, it just flares up worse. But 2, it's annoying as shit applying topical ointment through fucking hair.
Aww.
It sucks.
Yeah.
Poor guy.
Skylyr, this is more of a question for you.
Oh, just not even me. Dang, okay.
I mean, I guess I could
Wow.
I guess
Wow.
you could answer it.
Wow.
Also, it's a mononym, Strader.
I hate him. I literally hate him.
What's your view of barbers from a chiropractic standpoint?
Like,
Okay,
do
so
I
like
like them? Yeah, they cut my hair really well.
I don't believe in them. Barbers don't
Nah,
exist.
straight razor shaves, they're the
Yeah.
shit, man.
Do they exist?
No, I mean, but like,
We're talking about like Turkish barbers and all the shit they do in those videos.
no,
and
just like
things?
because my viewpoint of chiropractors from a barber standpoint is because you're the most in depth with chiropractics I've ever, really experienced.
Okay.
And it blew my mind, like the shit I was like, what the fuck? Like, this is how you do that? Like, you were like, okay, we're gonna roll your arm over here and then 3, and I was like, yo, what?
I think it's important to talk patients through things,
Yeah.
so that way there's expectations, and probably
Yeah, same.
top 3 reason to get a malpractice case is because you didn't explain shit, and it's like, oh, you put the person on your side, you put your hand on the upper part of their ass, and then you push down on it and noise happens, and then the wife goes home and tells the husband, I don't really know what happened, but he had his hand on my ass and like thrust it on me or something, and it's like, he fucking did what?
Yeah.
And so explaining what's going on, good advice.
Yeah.
Real good advice.
Yeah.
Anyone listening?
No, it was, you were very thorough, and I really do need to see you again. It's been,
Seeing me right now.
yeah. But
yeah, come on through.
But with my shirt off and the
Yeah, I know. That's how I prefer to see you too.
because I think it was like a year ago.
It was a long time.
Because I'm like, hey, I'm having this problem, and like you're like, yeah, come see me in a month, and I'm like, okay. Then life happens, and I'm just like, oh, my back's feeling fine.
right.
But now it's starting to kind of drift back into what it was before, and probably because I'm sitting like this isn't helping either. Okay, Bri. I do cut Philip's hair, so what's
I don't believe in barbers.
Yeah, we don't really exist.
Yeah.
They're fake hairstylists.
Even though we technically been around longer than chiropractors.
Sasquatch, yes. Barbers, no. Just wanted to put that out there. I actually went to a saxophone Sasquatch, or sax squatch.
We listen to him in here all the
Oh,
time.
I just went to his show in Vermont. So good.
Did they do the
Yeah.
Yeah.
It was so good. He signed someone's stomach.
That was for you guys, my barber boys who aren't here today. Yeah, John, Angel, and Moose decided to bounce because they were hungry. I don't blame them.
Strader scared him.
Yeah.
Strader.
I mean, Moose wasn't even here. I guess I really fucking scared him. Angel and John at least left after I got here, so that makes
Yeah,
sense.
they helped me set up.
I've never met them.
Any of them?
No, I don't think so.
Is this your first time in here? Or you? I think
No,
you.
no. I've been
she's
here
been
That's
here
right.
before.
That's
the
right.
first time. I think I met John Alex before.
Yeah.
Don't use
Yeah, you
his
definitely-
government name. Jesus
It
Christ.
literally has a picture with his name above it in a pirate-like outfit. With I think that's
Well, that's not
grapes.
pirate. It's a.
Also,
It's a like vest. I mean, I
I
guess.
think, I'm gonna just say I think
did you say pirate?
These are pirates. He looks like he's snowboarding. He looks like just like a gym teacher or something. I don't know.
Playing dodgeball today, kids.
Yeah.
So
As long as I don't have to get up.
So a funny story about Angel's picture is he's actually in the photo on the raw. He's holding his tit,
Oh.
and I photoshopped it out for that photo because it was I thought it was a good photo.
Oh, that's funny.
But in our Facebook, on our Facebook cover page, is that what that thing's called? The cover?
I don't know.
Oh, the very top.
Yeah. I did like a collage of us where we're kind of like in the line of each other, but I left the hand on the titty. So if you want to see the original, it's on the Facebook page.
I don't, but thank you.
This is a call to action for anyone listening in. Check out the Facebook page and the collage at the very top.
Yeah.
The cover thing.
We don't really do a lot of social media. We're pretty bad at it. We'll occasionally, like, I'll do a reel. Moose does reels. Angel really needs to give me some photo. Angel, if you're listening, I need photos so I can put you on the website.
Sounds like Angel's dropping the ball.
He is.
Yeah, right?
He is
Yeah.
dropping the ball.
Literally, chopping block or razor block or something.
Ah, yes, the razor block.
I don't know.
Okay, so what's advice you can give to people to improve their spinal health?
I mean, I guess the default answer is consult a chiropractor. But, I mean, in terms of what you can do on your own, let's say, lift weights, do yoga,
I was gonna ask
eat
you guys.
good,
Careful with the weights there, bud.
lift weights heavy, pick up heavy shit, put it down.
With good form and not that much weight. Just work your way up to it. So you don't go and try to
Well,
deadlift 400 pounds, never did, and then you have
you
no
think
arms anymore. They fell out.
Fucking Joey Chestnut started out eating 80 goddamn hot dogs in one sitting. No, he
don't know.
progressively ramped it up.
I don't know
like
who
you should with
Joey
everything.
Chestnut is.
You don't know who Joey Chestnut
No,
is? Man
I-
who can
I'm not.
crack down on hot dogs faster than anybody else on the planet.
I do like hot dogs.
Hot dog.
I mean, that's probably the basics is if you just stay strong and stay active, you're going to be better off for it. You're going to have probably more maybe episodic things because you're just lifting too heavy or weird movement and then you get a flare-up. But, like, who cares? You're probably going to be worse off if you don't do that stuff and just sit around and be sedentary. Because that's what all the research supports, staying active. And actually, I guess in the same vein, I think it was probably a couple years now, one of the guidelines came out that looked at all the different treatment aspects for lower back pain. And the thing that outperformed everything, outperformed surgery, PT, acupuncture, massage, chiropractic, was Pilates.
Pilates.
Love it.
And my theory on why it is a consistent, dedicated thing where you are held accountable by a group of individuals. You get the social element. You don't have to think about what you're doing. You just show up at the place for an hour, whatever your session is. That consistency just makes a world of difference.
So what's the difference between? I've heard the word Pilates, but I don't really know what Pilates are. Is it the same as? Is it yoga or is it like it's its own thing?
It's name brand, so it's its own thing. But
Yeah.
Pilates is a name brand.
it's in the same realm as like if you were gonna do a Zumba class or things like that. They all exist in the same.
See, I thought Zumba was just a form of workout.
Yeah, Zumba's like a dance workout.
Yeah.
Pilates is.
So it's just like a workout
Yeah.
plan that's kind of like copyrighted.
They also use like a machine called a reformer too, and it's a lot of like a mixture of like active and passive movements and stretching, and little fun aspects. Like you see, I feel like most people know what like cycling is, where like someone plays music and coaches them on. Pilates has like a similar thing to that too, where there's music and somebody's like egging them on, but then there's different types of Pilates too. One's for like slower, maybe if you're just getting into it. One's like pretty fast paced if you're pretty advanced too. And then yoga is, you don't really use many tools. Sometimes you use like a block or whatnot, but most of it's just like on the ground, either with all fours or 2 feet, whatever, stretching.
Yeah.
Yeah.
I really need to get into that. Being a barber, all the barbering I've done over the years, I'm starting to feel it in my back. I'm like, fuck. Because I get some weird positions.
Oh, yeah.
Yeah. Well, people's heads are weird shapes, so.
And then if you're like, even if I have you pumped all the way up and you're still not in a position, I have to like squat down and.
Mm-hmm.
Yeah.
And I'm terrible at stretching. Like that's my.
Definitely gotta stretch.
I just wake up and go, and I feel stiff. Yeah, when you popped me, I was like, damn, I'm more mobile than I thought I was. And I've been slacking.
You got the capability, bud.
Yeah, I just gotta come over. And then you fed me breakfast.
I sure did.
Wow.
I got adjusted in breakfast.
Mm-hmm.
Disclaimer: chiropractors usually don't feed their patients breakfast.
Oh yeah, am I allowed to talk about that?
No, no, it's fine.
About me cooking you breakfast?
Yeah.
Yeah, after you pop me, like it might.
Yeah, that's
okay.
Yeah, that's okay.
I just wanted someone to be like watching this, and I'm like, they didn't take me to IHOP.
Yeah, I just did.
Shit.
Where's
I've
my
been missing out
pancakes?
on things with my chiro.
Yeah. This man got pancakes.
Yeah, you haven't had the chiropractic experience I've had. And that was one of my first times dealing with that. So, what do you say to skeptics who think that chiropractic is like a pseudoscience?
Oh, well, I mean, there's elements that's pseudoscience. It's the elements I don't like in the profession but have stuck around.
Hey, what do you mean?
So, chiropractic first adjustment is like 1897. D.D. Palmer is a
1895.
Canadian.
Sorry.
Oh, whatever.
1897 is when the school was made.
Okay, well, fine. When the school was made, whatever.
Well,
Spoken
no,
like a person
It
who
was
works at a school.
1895 is when the first adjustment happened with Harvey Lillard. Remember? No.
Anyways, now that I'm done being fact checked.
Yeah. So well, shoot, I didn't want you. I just wanted you to like have a very great point to it. So I'm sorry.
I get it.
Okay, proceed. Okay, start it over.
Canadian comes down Mississippi River, lands in Iowa, does a bunch of magnetic healing, all sorts of shit, runs a small school, does all sorts of things. Classic motherfucker end of the 19th century.
Yeah.
And
like, come buy my snake oil.
There's
made with real piss.
Right? And so he's somebody that after he does an adjustment allegedly restores a man's hearing, for what that's worth. You have a man who's like, oh shit, I did something. I don't really know what I did. People didn't really know what the nervous system was back then. This is before people knew what like neurons and things were. So this man's trying to create some kind of a framework to essentially justify and build out a brand new profession. Yes, there are people who cracked backs and things in the past before chiropractic got established, but this is the first one, at least in the US, where they're trying to build it to a bigger, more legit industry. And so early on, there are different thinkers, just like anything, different philosophers who come up with their own little tidbits here and there and here and there. And some of those things, with time, have gone to the wayside. Some of them have perpetuated. One of the most common ones that you'll always hear is, I have never even seen this study, but it must have been done in like the 70s or something, but chiros like to reference what they call the foot on the garden hose analogy or something like that, where they're like, oh, well, they found the weight of a dime on a nerve disrupted the function of the nerve, therefore we need to get rid of that. It's not really how it all works. And you'll sometimes see a chart that has all these different nerves coming out, and it's like, well, your T7 nerve goes to your pancreas. So if you don't digest things well, maybe you just need an adjustment at T7 because that controls the pancreas. It's not that straightforward, because if that's how it was, quadriplegics couldn't fucking do anything below a certain level because they don't have the functioning that they need for these things. So some of these real basic ideas that now the research has shown doesn't really pan out that way, some of that has persisted in the profession, unfortunately. Whether that's because the people who originally believe these things then get teaching positions and then just teach the same stuff to a new wave of students, whether students looking for answers and certainty in a realm that quite frankly is not super certain cling to these things because it's really simple explanations. If someone comes in and they have a problem and you're like, this bone is out of place, I got to pop the bone back in and you'll feel better, and then you crack their back and then they're like, oh, I guess the bone popped back in, I do feel better. That's a simple explanation versus, oh, well, if the motion segment is compromised, the lack of proper motion being facilitated by the lamina 2 portion of the spinal cord is going to disrupt your raphe spinal cord tracts that control your internal analgesic pathways. Nobody fucking understands what I'm talking about.
This is almost poetic.
So
I'm just like, it's like you're just spitting stuff out right now. You're just like,
the simple
get a beat
philosophical answers are easy for patients to digest. So that's one reason it stays persistent in the profession, but also because we don't have as good of a standardization of things either across the profession. Different schools will emphasize different things. Most of our national boards and state boards are relatively lax with certain enforcement things. So as a result, people can kind of do whatever they want until they get too big for their britches, fly too close to the sun, and start talking about who knows what insanity. Then they come crashing down. But unless you're going out of your way to get noticed, probably can do whatever the fuck you want, unfortunately.
wow, that was deep.
I think
Thank you.
You have to remember that technically the profession started, 1800s, late 1800s. Like, we're still a newer profession, so there's still like a lot of research and things to interpret. Whereas like medicine, like general medicine, like you go to your primary care physician, that's been around since like the years BC or whatever. So that's kind of something to think about as well, is what, there's also bad apples in every profession.
Mm-hmm.
Oh yeah.
Yeah, like you can watch the show Dr. Death and just see that surgeon just ripping people apart just for like fun, just to like prove a point, but not prove it at the same time. So yeah, I would think I would tell skeptics that, because I feel like a lot of people are skeptic too because they have a friend or a family member where they're like, oh, like I went to a chiropractor, they may be worse, but maybe there's a lack of patient education, or you never know. So there's that to take home too.
Yeah. To piggyback off that, there's a lot of times patients give us one chance.
Yes.
That's it. And if it doesn't go well or perfect that first time, which sometimes just based off what their condition is, it's probably not going to go well immediately. But if you only give it the one shot, well, that's it. They just go around and they say whatever, and they're like, oh, I saw a chiro 34 years ago and he made me worse. And then you never see them again unless they really love their wife and their wife keeps telling them to come in. That's the only time they're ever going to make a change. But you don't get to that same degree with a lot of the other medical professions. Most people are not like, I went to primary care for the first time and they didn't believe me, and so I never went again. No, they just go to a different fucking primary care. Mm-hmm. But they don't usually do that with chiropractic.
They'll write off the whole profession.
Yes. So I encounter some patients like that where I have one guy, had a great experience with me, did great with care, had good resolution of his problems, didn't want to ever come in because he had gone one time in the past, got weird vibes, didn't feel any better, discontinued for like 28 years until his wife convinced him to give it another shot. Mm-hmm. So thank you to all the wives listening into the podcast. The advocacy in the home.
That was a good radio voice.
Oh my god!
You almost sounded like the sponsor on like Apple Podcasts, like the It's like one particular voice that like does all the advertisements.
Oh, really?
You almost nailed it.
Good job.
At first, when you started talking, I was like, "Wait, do I have an ad right now?"
Well, if you need an ad reader, I guess I'm here.
Yeah.
Spit out an ad right now.
An ad for what?
Just anything. Spit out an ad
Ooh,
for
people do ZocDoc all the time.
Razor's Edge.
Oh.
Yeah.
Or ZocDoc.
ZocDoc. Are you looking for a physician in your area code but don't know where to start? Try checking out ZocDoc for all of your consulting needs.
That's good.
That's pretty good.
Not actually sponsored by ZocDoc,
Yeah.
unfortunately. But hey, ZocDoc, I don't know what.
We could be.
Here's our phone number.
Yeah.
There's already a made ad.
Yeah.
Let's do it.
Let us know. I think they want. I think you have to have a certain length of time
For what?
for an ad.
Oh.
Yeah.
What do you mean?
Like they're probably gonna require you to have like, oh, I want at least 30 seconds of airtime. So they probably
that's
won't,
when you
they
just-
probably won't accept it out the
like,
gate.
I just like stretch it out.
That's when I just defer to you, and
like-
you're like, "Oh, thank you so much,
I
Doc
mean-
ZocDoc. I've never been so easily paired with a physician in my life before."
I literally hate you.
But technically, we're still on ZocDoc, so would it technically still be a ZocDoc ad?
There you go.
Oh, sure.
The ad ends right there.
Whatever.
Oh, sure, whatever.
Just look it up, guys.
Can you guys tell by how someone's walking or posture, like do they like general idea of what's wrong?
Ew. I mean, sometimes you won't know. Like, for example, when he was talking about his patient that was adjusted, they started limping, and it turned out to be an issue with his metastatic prostate cancer. We're not x-rays, we're not MRIs, we can't 100% guarantee this is what's going on right here, but if you come in and you explain to me in your history, and history is kind of like, what's the mechanism of injury? Were you lifting something? Were you driving somewhere? Did you fall down the stairs? We use a lot of like that information to actually diagnose people, but when I see people like hunched over, do I know exactly if they have a bone disease where they're stuck in that position, or if they're just really tight? Flip
the coin.
Yeah.
But
That's funny.
and there are people who do like a proper gait analysis too, and that's how they like do their whole practice upon as well. You want to piggyback on it?
Sure.
Always.
Wow. Ouch. You
It's
saying I
okay.
talk too much?
No, I like how you talk. It's good.
You guys are doing great.
Gives me a break.
You guys are doing great.
There are certain things that are pathognomonic, meaning specific to just one issue. So if you have somebody walking up to the office and when they step, their leg swings forward and goes beyond midline, that's pathognomonic for cerebral palsy. Or you can identify somebody who has a shuffling gait, Parkinson's, some of these type of things. I did get fooled recently. I thought the guy coming in had cerebral palsy. In fact, he had fucking polio.
What?
Who would have guessed?
Yeah. I know what you're talking about.
Well, he came to us as a new patient after you left, so you must be thinking of a different
There was a
polio
different
guy.
person.
Yes.
Then. That's crazy.
This guy was born in India before polio vaccine was in India, developed it, and has, I think he's got like 90% loss of strength in his one leg, and the other leg's like 50% strength, but he still walks.
Mm-hmm.
Kind of, maybe picture somebody walking on like peg legs. I think that was maybe like a Family Guy skit where it was just like a dude
it's
who just
got
had
that.
peg
Yeah.
legs.
Well, yeah,
It's kind of that.
It says all his limbs are like peg legs.
Yes.
Yeah, he's even got the arms. And
Yes.
I can't
So-
remember his name though.
Kind of walked like that, where it's just almost balancing on the fact that you just have a structure underneath you versus anything else. Sometimes you'll see somebody and very clearly their torso is kind of shifted off of midline one way or the other. Most of the time,
Like
that
me
means
right
it's
now.
a disc problem. Well, if you're walking at least.
And now you're making me all self-conscious over here.
Or what we call an antalgic lean. Some of those things, you have a good idea of what's going on. Other times, someone's like, the number of times I have patients and they're like, look at my walk. And I like watch them walk. I'm like, this shit looks fucking normal. And they're like, you see how weird that is? And I'm like, oh, sure, yeah, no. Like, what do you think's weird about it? And they're like, my fucking toe, bro. And I'm like, I don't know what you're talking about. You're wearing shoes. I can't see any of this shit.
I actually have a really good story with that.
Oh, go ahead.
I had a patient. She was like, watch me walk, which happens, you know. She's like, watch me walk. I'm like, okay. And she's like, does my right butt cheek look the same size as my left butt cheek? And I was like, relatively, yes. And she told me that she had gotten a BBL within the last like year or so, and the surgeon said he put more fat on the left side than the right side to make it even. And I just thought that was cool. I don't know why.
What is that? Like
What?
like a butt implant?
A BBL? Oh, it's a Brazilian butt lift. That's where you get fat from like your stomach somewhere, and you get it from your fat from like your stomach, your love handles, arms, and they inject it into your butt.
No.
Yeah.
Wow.
Yeah.
I just learned something new today. That's insane.
How do you not know what one is? I feel like everyone
Well,
talks about
I've never heard of it. I never heard of it called. I've just always heard butt implants.
Well,
But-
it's different.
The stuff people go through, like I would never. Like doctors scare me. I would never just be like, "Yo, take some fat out of me and place it into my ass." Like,
No, those are the people that they undergo those things, and they come in, they're like, I'm a little nervous about you cracking my back. And
really?
I'm like,
Oh, I love that.
Really?
I love
Why?
that.
That's wild.
I love that. Or like when they're, yeah, I'm a little bit like nervous for this, and I'm like, don't you like base jump? Like, I'm like, this is way less dangerous than that. I promise you.
I had a mentor tell me that if somebody would tell them, oh, you know, I'm a little nervous to do this, they just responded with, oh yeah, me too. And then they would like do it.
That's awesome.
Which I will say, there is a legit strategy of just not even pretending to take the person's concern serious, because it's so like outrageous. There are times where I can't think of a good example off the top of my head, where like somebody will bring up something and I just don't even really acknowledge it or try to talk them down. I just make a joke about it, and they're like, oh shit, I guess it's not a big deal because you just made a joke instead.
You know, that's true.
Yeah,
That's true. Because now that you say that, I've experienced that where I'm like, yo, I'm like freaking out a little bit, and then
I'm sure you.
my endocrinologist, my first time seeing him, I was like, oh, 'cause I got diagnosed with a pituitary tumor, and then my thing was like, okay, hey, am I gonna die from this? He's like, the only way you're gonna die from this is if you stress yourself out and jump in front of a bus. I was like, okay,
I love that.
sick. I love you.
Yeah. No, those
And
things.
I felt
work.
better.
And I'm sure you've done maybe something similar. If someone was like, I don't know about those straight razors. They look kind of dangerous. I've seen the movies where they like cut the guy's throat open.
And I'm like, oh, you seen Sweeney Todd? And they're like, yeah. I'm like, it's just like that.
We have
Straight up, that is how you bleed out if I do it.
Yeah.
We have a bakery in the back, just
Yeah.
so everyone knows.
Yeah. Yeah.
It smells like meat pie.
under this tile floor is a hole for you to slide into.
Jeez. You go right into like a meat grinder from there.
Yeah. Yeah.
Oh no.
Oh Jesus. Well, I guess we can start closing out. Is there? Well, you guys said you had other horror stories.
Oh, I got a lot. Mine are really gross.
See, we might have to have a second chiropractic
Yeah.
episode because we cut a lot of Palmer students.
Yeah.
So actually, it might be kind of cool to have like a student, maybe actually have like students talk to people who've been in the profession.
That'd be cool.
That'd be a
Yeah.
cool little segment.
I'd host a Q&A.
Let-
Why not?
cute.
Let us know when, however you hear about the podcast. We're terrible with social media. Just let us know somehow if you would like to hear that. Go ahead with your horror story.
Oh, like I can put like bullet points out there for
Okay.
sure.
So we'll just
I've
do
had-
like a couple more and then
I've
hold the
had
rest.
multiple patients like release their bowels on me.
What?
So, yeah, not
Baby
not
or
just
adult?
farts. They be pooping.
I have yet.
Yes, I've found poop on several people's pants. Several.
Are they older?
Yes and no. You would think, yeah, but I'd say like 50-50.
Oh, okay.
And then a lot of people that do fart, I'm very professional, by the way. Whenever they do, I just kind of brush it off. I don't say anything unless they comment on it, and I'm like, oh yeah, you got a big release today. But you gotta kind of test the waters with people though, like, because you don't want to make them upset or feel uncomfortable. I have had my fair share of patients just totally rip one so loud. I've never seen them again. So
They just get so embarrassed.
yeah.
I didn't shit on your table, did I?
I mean, if you did, I cleaned it up and didn't embarrass you.
Thanks.
I'm a professional.
And you fed me breakfast.
Yes. Got to replenish the tank.
I love that. I'm trying to think what else I got. There's a lot. I think that's the problem. Some of them even get into like just being a woman as a chiropractor, and it's a very, very intimate thing.
Yeah, I was gonna say, is it pretty different?
Oh, night and
no,
day.
yeah,
Night and day.
yeah.
I don't have patients sexually harassing me or thinking I'm coming on to them or anything like that. Partially because my resting face is kind of a dickish face, so I'm not super warm and welcoming in that way. But I don't encourage that type of dynamic. Female chiros, though, kind of can't avoid it because some guys out there are so horned up for any woman to ever touch them that they can't differentiate therapeutic touch from therapeutic touch. And so as a result, I'm
just laughing at how you said that and how you looked at me when you said that.
But no, it is a big realistic issue. And if you interact with any women chiropractors, they all have a story of some situation that has happened to them. Some male chiros will. Most of us won't.
Yeah. I had a patient not too long ago said that he likes it rough and to call him daddy.
Oh no.
And I just just keep going. Get them out as fast as I can. There has been a time where I asked someone to leave though. So.
Oh, how can you talk about that story or no?
Yeah, I can talk about it. So I had a patient a while ago. He just asked a lot of personal details about myself, like my phone number, my email. He was asking like if I had I have a husband now, but I had a fiance at the time, and he was asking about him, and then he just flipped a switch in his head, and I felt like I was just getting, I don't know, almost like made fun of and degraded. And there was a certain point I was like, okay, like I am just not feeling it today. You're gonna have to leave. But it was getting to a point where it almost felt like he was retaliating when I told him I had a fiance. So that wasn't cool. I ended up going home that day. I was like, I can't do it. But yeah, you'll have like the occasional like, I'm going to show you where my pain is at on you. Always.
Wait, what?
Oh yeah. So you'll have, and it's happened with female patients as well.
What did you say?
Okay, so a patient will come in and be like, yeah, like I'm really hurting today. Let me show you where my pain is at on you. And 90% of the time it's the butt. 90%.
When it happens to me, it's always shoulder blade.
I would love that.
There's
That's the
another
10%.
dynamic difference.
That's the 10%. But yeah, it's always butt cheek. And you can touch your own butt. There's no excuse to.
You sure can. You should wash your own ass every day, too, just for the record. In case anyone needs that PSA.
But the thing is, like, you could literally reach your own butt. Like, you don't even need to be flexible to get into that position. Like, it's. So, people are wild. That's pretty much it. But, it's fun. You just got to be a little bit positive with your patients, because a lot of it's just positive reinforcement and making them know that they can do things, that they're not permanently disabled, that their pain doesn't take over their whole life, that they're able to, get out of pain, get out of this episode and get back into it, whatever they like to do, or encourage them to actually do something. That's important too.
I feel like I'm a pretty confident person, and I still don't understand how I guess mostly men, but also some women can be that confident to be like, oh, I'm getting adjusted today. Let me sexually harass my chiropractor.
Right?
Oh, it's because the next step above confidence is delusion.
Yeah.
That's where they're
Yeah.
at. Is
Okay.
and so another PSA, if anybody listening wants to fuck their doctor, it's unethical for the doctor.
Yeah.
Don't put
Oh,
them
yeah.
in that situation.
Dude, anytime I've ever had to like drop trowel, I am turtlenecking. Like I am like it is receding into my stomach. Like that is how uncomfortable I am.
You're not getting raging hard on?
No, I don't. I am literally like, oh.
I've never asked a patient to drop trowel. I just want to put that one out there.
Well, it's like if you have,
I
if you have
don't
to
think I have either.
I don't think so. Maybe unbuckle your belt buckle so it doesn't tear up the table.
Well, my dropping trowel wasn't for chiropractic.
Are you sure? Is that why you got breakfast?
That's
It was
because he
for-
dropped my trowel.
It was for an actual doctor.
Oh,
There you go. Good specification.
hit us low. It's fine.
Yeah, if you want to show your dick to a doctor, don't see a chiro. See someone else.
Typically, a urologist is when you're gonna.
Well,
show
that's probably the most appropriate.
yeah. And that's what I was a urologist,
Okay. A little bit different.
but it was still shriveling up there. Not a good time. Not a good
Sir,
time.
I'm here to inspect your penis, and I don't even see it right now. Where is it?
That's how it felt, bro.
Oh, no.
That's what I'm saying. Like, I don't understand how men get like that. Like,
I've had women hit on me too, so
well, yeah,
yeah.
Oh,
I've had
mostly
all
men,
genders,
some women, some
Yeah.
women.
all the people, anyone that talks. It
No,
happens.
there's a reason why a lot of chiros don't close their treatment room door fully when
Yeah.
they're treating, because they don't want the he said, she said dynamic of anything that happens behind closed doors. Because there's been some situations where a patient has propositioned a chiropractor, the chiropractor rejected their advances, and then the patient claimed the doctor sexually assaulted them in retaliation, and then it purely becomes a who's more convincing
Yeah.
in front of a jury of your peers. And it's not a situation you want to be in. So the setting I work in, we record all treatment. I would probably recommend for most people, they probably should do something similar.
Yeah.
Per state of Florida, we are a two-party consent state. So if you are going to be doing any recording in the office, make sure the patient is well informed, both in written and verbal, upon entering the office for the first time, and have them sign consent paperwork reflecting they understand, acknowledge, and accept that they will be recorded on premises.
I wonder how that works on the podcast, or is it just?
In most offices I've worked at, there's a button somewhere for me to touch that alerts the front desk, office manager, somebody
Excuse me.
else, like, hey, come back here. I might need some backup for something.
Yep.
It's only for emergencies. If something gets weird, or even if the vibes are off, you know, eye contact goes a long way too. So
It's, yeah, consent is sexy, and don't
Sure is.
sexually harass your doctors or chiropractors.
Please.
Please.
We're out here fucking begging.
Like, it's not that hard.
just trying to do my job. I promise.
Yeah.
Yeah, it's not.
I
that-
just want to like crack your back, man. I don't want to give you a reach around or anything else. Please, please.
Well, I guess closing out. Do you guys have anything you want to add?
No, I don't think so. Oh yeah, Strader and I used to work together. I feel like we should have talked about that too.
Oh.
But that's how we know each other.
Yeah, that
And we're
was a question.
besties.
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 Yeah, and Skylyr's one of my clients that I.
Mononym Strader.
He's. How long I've been cutting you now? Like 2 years?
It's been, let's see,
1 week since you looked at me.
it's probably almost 3.5.
What?
Actually, because
No.
So I moved here July 2021, and initially my plan was to just drive back to my old barber every few months or something, see family and things anyways when I'm down there. And then it got to a point where my other bestie was getting married, and I needed to have at least the back of my neck cleaned up. And I was like, hey babe, I'm married as well. Hey babe, can can you just like clean up the little fucking hairs back here so I don't look shitty as I'm in this wedding? And she was like, no, I'm going to find you a barber. So she looked up and she's like, this guy seems like he'd fit for you, the Hobbit barber. So go see him.
Hell yeah.
And it was
love
good.
that.
Match made in heaven.
Yep. And now I got thrown into the circle of friends. And then that's, I met you through Philip.
Actually, I met Aaron at an I Love Shrek festival up in Toronto, Ontario.
Oh.
It's not a real thing. It probably is, honestly.
That's exotic.
It might be a real thing.
Shrek is love.
Shrek is love. Number 5 coming out. We already bullied them into changing the animation. It's fine.
Well, so now I'm in y'all's little quirky circle. It's fun. It's been a fun time. Well, thanks guys for coming on. I appreciate
Thanks
you.
for having us.
I will give you a shave though. Not tonight, but I will give you.
That's okay.
For coming on, I got you, fam.
Love it.
I'm not getting shaved.
But I'll give Philip a haircut.
Yes. Sounds good.
for your time. Thank you.
Oh my gosh, no. I pay for services, guys.
No, I'm just meant for coming on. It's like a thank you.
Yeah, stop rejecting thank you gifts.
I'm sorry.
Jesus.
I
accept graciously the shave you're offering at a future date. Thank you.
Yeah, of course. Absolutely.
Means a lot.
Of course, absolutely.
I know how to properly receive a gift.
Oh, thanks. Thanks.
But yeah, this has been Chiropractics 101 with Skylyr, Mononym, Strader.
Don't know if that's how it should flow, but it's all right. We'll go with that. Mononym as the middle name.
And Bri Wolfer.
Yeah, that's me. Honestly, just delete the whole thing.
Well, thanks guys for coming on and thanks for listening.
Yeah, thank you.
Love you, bye.
In fall.
But I love pumpkin, so I have pumpkin wafflers.
I'm a basic white bitch when it comes to pumpkin. I love pumpkin spice latte, especially Starbucks' pumpkin spice latte.
Sorry, this is an anti-corporate coffee podcast. We do not shout out Starbucks on air, live.
Not sponsored by Starbucks.
Yeah, but
I do like y'all's pumpkin spice latte.
I don't drink coffee, but I do enjoy the
Blasphemy.
smell of it.
I do.
Yeah.
I'm a coffee whore.
But if you are interested in sponsoring the podcast, just reach out to Aaron, can't remember fucking last name, at gmail.com.
Wait, what's your last name?
Shook.
Oh, yeah.
That's
I feel like we
right.
knew this.
Yeah, because I think in our group chat you just say, "Listen here, Shook."
Oh yeah.
I think in the last text between asking for the podcast, you're like, "Shook, if Strader talks shit."
Oh yeah.
Stab him.
Yeah. I was like Todd Sweeney or Sweeney Todd.
Yeah, Sweeney Todd.
That was
I
when there
always-
was like 86 fucking replies. I didn't actually read them all.
Yeah.
I just kind of.
Pretty much, I said if you said.
Oh, this is
anything bad
before.
about
This is
me,
before the group chat. This was me like asking you about the podcast. And
Oh.
let's get Bri on it because a male female.
I was
like-
I was kind of scared about where the question was going because you didn't mention anything. Just like, what are you doing Wednesday at 6 p.m.? And I was like,
Orgy.
I was a little
Always.
stressed.
Speaking of which, I have Philip's shirt still from last time you had the orgy at our house, so you can have that back tonight too. Don't forget.
Tell Philip I love him.
Okay.
He's such a cool guy. I
Right.
want to get him on here. That'd be fun.
Yeah, he can talk about I don't know German shit or Ford or AI. Yeah, he can talk about that shit.
Yeah.
All right.
Or how to be a good spouse.
Oh yeah, he is a good spouse. It was his birthday.
Oh, hell yeah.
What was the 3rd? Today's the 6th.
3 days ago was his
Yeah.
birthday?
It was on Monday. Yeah.
Man, how are you gonna forget that?
Bro,
I mean-
I know like 4 fucking birthdays.
That's true.
Actually, 5 because I have a daughter now.
What's
I know
my-
5 birthdays now.
What's my birthday?
Don't fucking know.
Dang. Isn't yours like August 9th? or
August
8th?
9.
August 9th? 8th?
Yeah, it's the 8th.
Damn. See, I was close.
You guys ready to jump in?
Sure,
Okay.
sure. Go easy. I'm a podcast virgin.